So tonight we're going to tie in the all too prevalent and all globally worrisome COVID-19 virus, or the coronavirus. The whole world has been shaken upside down as we're incorporating a lockdown strategy across the world to minimize the effect of this virus. And last week I shared some of the facts and statistics on this situation. Today I'm going to share two things. One is from the BC College of Family Physicians. They sent out an infographic today to all medical practitioners, and I thought it'd be great to share that with you. So let's dive into that first. So there's 5 main topics on this. One is turn to telemedicine. Physicians in this province of BC are being paid to see their patients either by telelink, like Zoom linking on your phone or your computer, or even by phone. And doctors have been slow to incorporate this over the last couple of years, myself included. But now, today I was doing some consultations by phone, and will be doing so over the next few weeks as my clinics actually are closed. So telemedicine, great way to communicate with your practitioner. Maybe get online, maybe check out maybe their phone call, they'll maybe phone their office. Maybe there's a way into achieving that. Number 2, embrace your home base. The advice across the board is stay home. And I think for all intended purposes, this is generally a good thing to do. If you have a virus, it's best to stay away from other people who may have viruses. Many people have got symptoms. Maybe they've got a sore throat. Maybe they've got just not feeling too well, like malaise or lethargy, but not specific for the corona, which is fever, coughing, and shortness of breath. If you've got these 3 symptoms, you've almost certainly got this virus. And testing does not need to be done in BC anyway on asymptomatic or patients without symptoms. Next one, remain close at a distance. So we know we've got different ways of communicating these days. We've got our phones, we've got texting. So use these distance ways of communicating with people. I think if we're with loved ones and you've been with them, then if you have a virus, then you will be likely transferring it anyway, because there's up to 2-3 weeks incubation period, which just means the virus is there, but you don't feel it or know it yet. So if you've got it, you're likely passing it around your family. So staying within your family unit is absolutely fine. Next thing they say is don't fret if no test. And as I said, we're not testing everybody. There is testing for people at specific sites, and I would just recommend you Google that for the site nearest you if that's a requirement. Likely walk-in clinics, hospitals, but check that out. And the last one is about sneezing, about using proper methods like the old cough into your sleeve approach if you're about to sneeze, or using a tissue. Very important. Don't touch your face. We do this all the time unless we're aware of it. So try as much as possible not to do that. And also common sense, wash your hands. 20 minutes, get the soap, get the lather on there with water. 20 minutes all around like this. In between. So if you're at the washroom or before you eat food, if you're going outside, when you come back inside, I would wash hands. So just common sense approach, but think about optimizing our hygiene. Okay, so the second approach is what vitamins should we be taking? Now, I was talking to Professor George Grant from Toronto this week, and he's a very interesting fella. He's got 3 masters in toxicology, nutrition. He works with people with pain. He's been advisor to the federal government for about 10 years. And he was actually the advisor when the SARS virus was prevalent not so many years ago. And it was a great guy to talk to in my podcast show this week, because he was saying 3 things, or 5 things actually, but 3 vitamins that we should be optimizing our immune system with. And this is full of research behind it. This is not Dr. Wayne just giving you an idea of what I think. But no, this is lots of research. He's got it on his website, and he was talking about vitamin D, 10,000 units or 20,000 units he takes personally, but 10,000 units is the amount being recommended. I've been taking 5,000 units for a long time per day, but 10,000 is perfectly safe. And if you are worried about the safety of this, there's actually studies showing doses of 200,000 units to 100,000 units a day. Perfectly safe. No deaths, no complications from this. And to be honest, it's a bit like staying outside in the sun all day. You're going to get lots and lots of vitamin D. So vitamin D, wonderful vitamin, and almost like a hormone in the body, because it's got so many functions. Not only helps your brain health for chronic pain, it helps your immunity, and a variety of other different functions. So the second vitamin C, 5,000 milligrams a day. That's a lot, an awful lot. That's more than I'm taking. But vitamin C, 5,000, they come in 1,000 capsules or tablets that can just dissolve in your mouth. And the dose of that is really about diarrhea specific or gastrointestinal symptoms specific. And if you take too much, you'll get diarrhea, classically. So if you take 5,000, it's too much, you have some diarrhea, cut back to maybe 1,000, 2,000. But usually, people can take up to 5,000, 10,000 units of vitamin C in a day if they're really sick. The third mineral, in this case, not a vitamin, but zinc, 30 milligrams, he was mentioning on the podcast show this week. So 30 milligrams zinc being shown to help with your immune response and fighting those bugs in your body. Two extra things our Professor George was saying was get outside and also sunshine. I think we're forgetting this in the realm of common sense when it comes to the COVID virus, is when we're outside, we're in nature. And if we're outside, we have natural sunlight. And these two things were the factors that prevented or halted the worst pandemic flu in modern day history. And that was 102 years ago in 1918. It was the Spanish flu. It was around the world. It was killing lots and lots and lots of people. And it was halted not by staying in a hospital or indoors, but actually getting outside. And it's been wonderful today. I've been outside myself. It's nice weather here in BC. And just seeing lots of families going to the park, couples going for walks, people on their bike or going for a walk, walking dogs. Get outside, stay away from lots of people, just be on your own. I think that's perfectly reasonable. Keep that distance, but getting outside is one of the healthiest things I've found, not just for this realm of COVID-19, but general health. Gets us synchronized back into more a natural rhythm. And it's a great place to go if mentally you're struggling or having a rough day. Just spend some time outside and let nature help you, because I think we're one and the same thing. So these are my few tips tonight on the COVID-19 virus and how you can optimize your health. I hope you found it helpful. Please leave me a comment. Thanks for joining me once again. I'm looking at all the names there. It's great to see you, and I look forward to the next live stream. Have a great evening, be safe, and don't let the panic of this global virus get to you. Go to your happy place and be yourself. Take care. Bye-bye.